Hello everyone. The title of today's presentation is Comprehensive Evidence for Mortality and Underlying Morbidity Related to Visceral Fat Distribution. This study was led by the School of Public Health, Tongji Medical College, Huazhong University of Science and Technology. My name is Haolong Zhou, the first author of this study, and it is a great privilege to present our work to you today. The global rise in overweight and obesity poses a major public health challenge. Although body mass index, BMI, is widely used to assess obesity, it cannot distinguish between muscle and fat mass, nor does it reflect fat distribution. Furthermore, relying exclusively on BMI to define obesity often leads to the obesity paradox in middle to old-aged adults, and the underlying mechanisms remain elusive. While previous studies have developed various adiposity surrogates, there is a lack of large-scale population studies comprehensively evaluating their predictive performance for mortality. Additionally, the key disease states in the progression from obesity to death remain unclear. Here, this study was to comprehensively evaluate the relationship of 8 adiposity surrogates with mortalities in the National Health and Nutrition Examination Survey, NHANES, and UK Biobank, UKB, in order to propose a superior adiposity surrogate. Then, we assessed the causal effect of the superior adiposity surrogate on mortalities from a genetic perspective. Additionally, phenome-wide association study, PheWASs, and multi-state Markov, MSM, modeling were performed to shed light on etiology of the superior adiposity surrogate-related mortality. This study included a total of 11,706 participants from NHANES and 352,980 participants from UKB, all aged 45 and older. During median follow-ups of 8.67 and 12.84 years, 2,698 and 26,819 deaths occurred in the two cohorts, respectively. In fully adjusted Cox models, the lipid accumulation product, LAP, cardiometabolic index, CMI, and a body shape index, ABSI, demonstrated consistent and significant positive associations with all-cause cardiovascular disease, CVD, and cancer mortalities in both the NHANES and UKB cohorts. Notably, ABSI exhibited a relatively larger effect size. Restricted cubic spline analyses showed that BMI had either a nonlinear or non-significant association with mortality. In contrast, ABSI demonstrated a significant, monotonically increasing dose-response relationship with all-cause CVD and cancer mortalities. This characteristic helps circumvent the obesity paradox commonly observed in middle to old-aged adults. Furthermore, ABSI showed a weak correlation with BMI in both cohorts. Inherently, by combining height, weight, and waist circumference, it provides body shape information independent of BMI, captures body fat distribution, and is easy to measure. Given these combined advantages, ABSI was selected as the superior adiposity surrogate for subsequent analyses. In the nonlinear Mendelian randomization, MR, analysis, we adopted the doubly ranked method for robust assessment. The results demonstrated that both genetically predicted ABSI and BMI exhibited significant linear causal associations with all-cause mortality. Linear MR analyses confirmed that genetically predicted ABSI had a significant positive causal effect on all-cause mortality, with an effect size exceeding that of BMI. The observational and MR-PheWASs identified 668 diseases associated with ABSI. The overlapping high-burden disorders in both PheWASs were atherosclerosis, non-alcoholic fatty liver disease, NAFLD, type 2 diabetes, T2D, and hypercholesterolemia. Co-localization analyses confirmed that these 4 disorders shared key genetic variants with ABSI. MSM modeling further elucidated a driving role of ABSI, not only in transitions from disease-free state to onsets of the 4 diseases and to death, but also from diseases to death. Over 5, 10, and 15-year intervals, transitions from a disease-free state to incident hypercholesterolemia, and from atherosclerosis to death, showed the highest probabilities. These findings provided evidence for staged prevention and intervention strategies in high ABSI individuals. In summary, considering the association strength, cross-population consistency, interpretability and measurement convenience, ABSI possessed unique advantages in mortality risk prediction. Underlying explanations for visceral fat distribution mortality etiology are diverse diseases across multiple systems, notably atherosclerosis, NAFLD, T2D, and hypercholesterolemia. High ABSI significantly increased the risks of transition from disease-free state to the 4 disease states, and ultimately to death. These findings provide more evidence facilitating development and implementation of clinical guidelines for obesity assessment. Thank you all for your time and attention.